Good morning, guys. Happy Monday. Today we are going to talk about fevers, which is a very common topic I get asked a lot of questions about. So first, let's remember that a fever is our body's natural response to an infection. It's a sign that our bodies are doing what they are designed to do. So they are going to fight off infection, whether this be a viral infection or a bacterial infection, which can be more serious. Our body is doing what it's supposed to do. The fever is the temperature elevation and it's fighting the infection. So fevers are not always a bad thing. So some important things to remember about fevers too. This is a rectal temperature greater than 100.4. In an infant less than 2 months of age, we take that very seriously, and it often requires a pretty extensive workup, more of like an immediate visit with their physician and some evaluation that's going to take place, versus in a child that's over 2 months, it's not going to be as urgent, and we might let that slide a few days and give different types of advice. So that's just something important to remember. Less than 2 months of age, very, very important to talk with your doctor right away. So a couple things can cause fevers though too. So this can be something from a simple cold, an ear infection, to more serious causes in children such as pneumonia, urinary tract infections, COVID-19, which is a more recent concern, flu, MIS-C, which is a post-COVID issue, and RSV. So many different things can cause fevers in kids. The fever can last for many days while our bodies are fighting off these infections. There are times when your pediatrician will want you to come in right away, but there are also times where we might just give you some home care advice and say, hey, follow up with us. We might want to see you after 3 days if this fever persists, or after 5 days if the fever persists. Usually as the kids get a little bit older too, we have a tendency to use more of like that 101 as a temperature versus that 100.4 that we use in those tiny babies. So we have very specific questions that we may ask you, certain things in the history that might give us a little bit of a red flag that prompts us to have you come in sooner, or let you extend at home before we have you come in. It's also important to understand that fevers do not always need to be treated. And by treatment, I mean using Tylenol, ibuprofen, Motrin around the clock. You do not need to do these like every 4 hours, every 6 hours. You do not need to alternate unless you're given very specific instructions to do so. So these medications are designed to help children feel better. They help with those symptoms and they give them more of that comfort, because as we all know, when we get a fever, a lot of times you feel really crummy and you get a really bad headache too. So those medicines are designed to help alleviate those symptoms. So if your child is really fussy, just kind of feeling really icky, then go ahead and give them that dose of Tylenol or Motrin. But if they're just hanging out, they got a temperature of 101, 102, and they're sitting there and they seem to be doing okay, just watching TV or something, and not really complaining that much, you probably don't need to give them that medicine. Let that fever stay up there, fight off that infection in the body, and that's okay. When that temperature comes down, or when they're kind of perked up, is a good time to work on hydration. So that's when you want to be giving them something to drink, little snacks or something, because usually that's when they're going to be feeling their best during these illnesses. Another important thing to remember, no Motrin, Advil, ibuprofen until the child or infant is over 6 months of age. We do not give that medicine beforehand. Another thing, 2 things to remember. Infants' Motrin is not the same as children's Motrin. So these are not the same medications. The concentration is different. However, that being said, Tylenol, children's Tylenol and infant Tylenol, exact same thing. Same concentration, you're just paying for different packaging. So it's important to differentiate those two. On my website, under resources, I do have a whole page on dosing for these, because if you look on the box, it says call your pediatrician. So instead of having to call your pediatrician in the middle of the night, you can check the website. I have the weights listed and I have the dose that's appropriate. Now, obviously, if you ever have any questions or concerns about your child, you should reach out to your pediatrician. But I just wanted to give you a very simple overview on fevers. So if you have any other questions, concerns, comment below or let me know.